Hi guys, so I'm here to talk about having a lower lumbar discectomy. Yesterday I had L4-L5 discectomy on my left side. My left leg has been having nerve issues for a little over a year now. The injury started really hurting like over 2 years ago. So I've tried to do like PT work. I've tried to do epidural injections. I've tried facet joint injections. The facet joint injections actually did work pretty well, but none of my epidural injections have really relieved all of the pain. Like it does for like a week or two, and then, it comes right back. So I went to a neurosurgeon, and he suggested that I get a discectomy. And so I did, and that was yesterday. I'm making this video just because I feel like there's not a ton of information out there. When I was looking for information on discectomies, I didn't really find anything, and it was difficult. But I did ask some people on Instagram, and a lot of people who have had the same procedure have been able to help me. But once I went on YouTube, I didn't really find much, so that's why I'm doing this video. So, let's see, let's start from last week. So last week I had to stop all medications. So like no ibuprofen, no muscle relaxers, no anti-inflammatory stuff. Everything was, I just got off everything. They said that I could take my gabapentin, but I've been really trying not to take my gabapentin. I don't like the way that it makes me feel. It makes me have like a lot of brain fog. So I only take that like when I absolutely need it. So then my surgery was yesterday. I went in, they just said like wear baggy clothes, and then I went into like getting ready for surgery. I was so dehydrated. So I actually was able to eat breakfast yesterday. I had to stop eating at 7 in the morning, 7:30. My surgery was at 4:30 last night, which I was kind of glad that I was able to eat, because I would have been very nauseous, very irritable if I didn't have anything to eat or drink in the morning. So I had that, and I felt really good for the rest of the day. But they did have issues finding a vein on me that would work. They ended up going on this hand, but that was their third try, and it took them quite a while. I have like a pretty big bruise on this hand right here. It's like coming in, and it's really sore. They tried really hard, but that's the hard thing, is when you don't have any water in your body because you're not drinking it, your veins are really small. So once they did that, I was still pretty nervous. Like my brain was fine, but my body was really anxious, and so it was shaking a lot. And then my doctor came in to pre-op and kind of talked to me about what was going on, and wrote like on my leg which one he was going to be operating for. And then the anesthesiologist came in and was so thorough with putting me to sleep, and made me feel so much better about it. I think that was the part that I was most nervous about. I've only been put to sleep once, and that was for like getting out my wisdom teeth, so that's not really like a big, being put under. So he was great about it, and then they gave me some anti-nausea medication, because I had a feeling that with some of the medicines and anesthesia that they would be giving me, I would be really nauseous. So they put like a patch behind my ear. It's still there. He said to keep it on there for a couple days. They gave me, I don't necessarily know all the medications they gave me. I kind of forgot, but they gave me synthetic THC, which really helped just calm my body down instead of giving me like a Valium or something. And then that worked. And then they started rolling me to the operating room once I started getting a little bit more relaxed. And then that's when they put the sedative in my IV when we were walking to the operating room. So by the time we got to the operating room, I was kind of giggly, and I was just talking weird about like how cool the machines were, and it was such bright lights and all that stuff, and my nurse was laughing at me. And then they put, the mask on my face to put me to sleep, and it definitely worked. I was like, this is not oxygen. And so then that happened, and then I just woke up in the outpatient post-op, and I immediately woke up, and I was terrified because my leg was completely numb. And at first, like, I was like, is it just because it's so heavy? Like, he just operated on it. But my lower lumbar on my back didn't hurt at all, like where the incision was or anything. I didn't really feel anything back there. Today I feel a little bit of muscle soreness, but nothing bad. I think the thing that's scaring me the most is my leg. So it feels like it's my L5 nerve going down my leg. So it's like behind my thigh and then on the side of my calf all the way down to the top and the bottom of my foot. So the only toe that's not numb right now is my pinky toe. And it's like so numb that I can't like lift up my foot like that, or I can't really like bend my toes like that. And yeah, I can't do anything like that. I can move my foot side to side and I can bend them just a little, my toes just a little bit, but so I was really struggling with that. I was nervous about it. I had a friend who had the discectomy tell me that like the first week was really hard, and they ended up giving her steroid injections or a steroid pack to take home. So when I told the lady, the nurse at post-op about my leg and how I was like, it wasn't feeling good at all and I was really nervous about it, she ended up giving me a steroid injection in my IV to kind of help jumpstart the process of that nerve healing. And then they said, hey, call in the morning, if you have any more issues. So then I got discharged after they gave me that steroid shot, and my husband was able to take me home. The one thing that I highly recommend on your way home is pillows. I made sure that I grabbed 2 pillows for my back just to be more at ease. I sat on a pillow, and then I also had a pillow like just to cuddle with, just to make myself feel so much more comfortable, because I was still really woozy from the anesthesia and I was like falling in and out of sleep. So that helped a lot. And then when I got home, I've been in this recliner ever since, and my husband slept in the bed next to me just to take care of me. When I came in to the house last night, I was a mess. I was trying to like find a way for my husband to help me walk, and it really wasn't working well. I couldn't find a way to like position my body weight on him while feeling stable as well. So I ended up using like, I have hiking canes to like, hiking sticks to like help me walk, and I used those with his support, and that helped me a lot. But I still felt very unstable, and like if he wasn't there, then I would have fallen. And so I went to bed last night in my recliner, moved all the way back, and about 5 o'clock in the morning I woke up and I was like, I need to walk around. I just feel like my body needs it. So we started walking around, and I was like, I think we need to go get a cane. A walker. So my husband went to Walmart and got me a walker, and that has been so much more helpful. I've been trying to walk once every hour just to, help my nerve feel better and heal quicker. And but so my doctor called me today, and he said the nerve numbness could have been from one or two things. So he told me he went in and he cleared out like all the disc, which is great, that was protruding. He said the surgery went great. I wasn't bleeding much. He did have to take off quite a bit of bone spurs that were on my vertebrae that was smushing up against my nerves as well. So he took those bone spurs off. But he said like everything went really good. But he did have to move the nerves to the side while he was, shaving the bones off and stuff. So he said they could have just been irritated from being moved around. Now that they're unpinched, they're like, what is going on? They kind of freak out. So that was one option that could happen. And he said that'll take like just a couple weeks to recover. Or he said there could be a blood clot that formed later, like after he closed me up. So he wants me to get an MRI tomorrow just to make sure that there's no blood clot. And hopefully there is no blood clot pushing up against my nerve. But so far so good. I haven't been, I've taken one muscle relaxer. I've taken just a half of a hydrocodone. I felt like I really don't need to take that, but I just did it just in case. And then I am taking anti-nausea medicine just because of the other medicines. They kind of make me a little drowsy and like nauseous. But other than that, I feel in pretty good spirits. I was very emotional last night, very scared about my leg, but I feel a lot better after talking to my doctor. So that's going on day 1 after a lower lumbar discectomy. So I will update you as the days go on, and hopefully this helps somebody out there.